Hello, I'm Dan Mustard, the Executive Director of Millrace Center in Columbus, Indiana. We're a center for active adults who are age 50 and over. I'm speaking with Dr. Stacie Wenk, who's the past president of the Indiana State Medical Association. Dr. Wenk is board certified in internal medicine and geriatrics, which deals with medical conditions associated with aging. We're talking about the novel coronavirus, Covid-19, which can be particularly dangerous for older adults. Welcome, Dr. Wenk.
Good morning.
Some of the discussion that has been occurring and some of the information that has been around has been, especially in some of the areas that have been harder hit, and some of the ethical questions that doctors are having to face with the scarcity of resources and the possibility that they may have to make decisions about who receives those resources when there are too many people who are in need. As a physician, what would be your approach to that, and how can people have that conversation with their families, especially from an advocacy standpoint?
Sure. So I think I want to preface with, this is a moving target. We are learning new things every single day about coronavirus. And so what we talk about today may be modified as time goes on. So I would ask you to be mindful of that as we proceed. I would say that we're very lucky right now in the United States. We have been able to accommodate all patients with coronavirus, particularly in the intensive care units. We are still lagging behind on testing, as well as understanding that the vast majority of people who do get coronavirus will recover. But because we have such little information, it's causing quite a bit of fear. And I'm seeing that amongst my family members as well as my friends. And I'm finding that I feel a little bit inadequate sometimes in my answers by saying, I don't know. The one thing I do know is taking care of yourself is the primary goal right now. Making sure that you're keeping yourself at a safe distance from other people, washing your hands continuously, moving towards what can we do today, aside from keeping ourselves safe, is we can use this as a springboard, if you will, not an opportunity, but a springboard to start talking to each other about end-of-life events, not necessarily COVID itself, but globally. It's something that all of us at some point will have to address. But to have an opportunity now to sit down and say, these are the things that I really want to focus on as I'm leaning into my end days, if you will. Talking to your family members, not being afraid to talk about these situations with your family members, giving them essentially three different types of approaches, if you will. The first is prolong my life. Understand that this is a very unique time. And if that is what your wish is, that is what your family and the medical professions will do. The second is help me maintain where I'm at. And in that case, it's providing care, maybe not the intensive care environment, but providing me care so that I can maintain the status that I'm at today. And then in the more frail or very ill patients and people that today are frail, talking about make sure that I am comfortable. Don't let me struggle and suffer as I go through the next phase. Again, be it COVID or any acute health issue.
This is a difficult subject, I think, for many people. Part of it is cultural. I think Americans in general are not good at talking about end of life and some of those wishes. What would be a good way for folks to be able to approach that conversation? Who should it be? Should it be children, adult children who are having the conversation and bringing it up? Or should it be individuals who are having that conversation with their families?
I think that both are very reasonable approaches. I think it's difficult for me. I have a mother who will be 80 this year. She has fairly good health, but we had this conversation just yesterday, and there's fear. There's fear right now. So I had to rethink my process with her and allow her to express her fears, to understand what those fears were, and then to be able to say, what happens if you get this virus? What happens if you have pneumonia and you need to go on a ventilator? What do you want in those situations? Do you want to go on a ventilator? If you're on a ventilator, do you want to move towards the chronic ventilator issues, or is there a point where you would want to stop? It may be a little bit easier for me because I am in this arena, but I think that it is a blessing and a gift for adults to give to their family members or their friends, to choose somebody that they trust, that can maintain those wishes.
Mm-hmm.
Emotions become very high when end of life becomes imminent. And to be able to step away and say, this is what my loved one wanted, this is what we should do, and understand that it will be very painful for the people providing that information, but they won't have to make the ultimate decisions. They'll be able to sit at the bedside and be a family member or a friend.
That's excellent advice, and I think that many people will be comforted by the ability to have that conversation with folks. Can you explain, as a physician, why the coronavirus is especially dangerous to older adults?
Sure. Coronavirus is very unique. It's not the same as the flu. It's a completely different genetic makeup. It's something that human beings have not been exposed to in the past. So it is attacking the immune system. And as we age, our immune system becomes a little bit weaker. And I would say the same for pregnant women. They're at high risk as well because the immune system is not as strong. As we age, we tend to have a little more medical issues, heart problems, lung problems, diabetes, and that we have found increases the risks of more severe cases of coronavirus as well.
So what can older adults do to lessen their chances of exposure and infection?
Sure. I think that some of the great things that we're seeing are friends and neighbors offering to go to the store and keep our elder population at home. I will again go to my mother. She is not happy. She's a very active person and likes to shop. And I've been doing her shopping for her. I've been staying just at the door, the lack of human contact. So pick up the phone and talk to your loved ones so that they're not feeling so isolated. But truly right now, for the next 30 days at least, stay inside as much as you possibly can. Of course, except going outside to get some fresh air. Limit your exposure to others. If you're starting to feel any type of symptoms at all, or somebody in your house starting to feel any symptoms, then separate yourself from them. It's fine to stand at the door, but stay out of the room.
Okay, that's excellent information. And I think that perhaps if there is a silver lining to this horrible illness, and it is the fact that, number one, people can begin to have some real conversations because it's bringing that to the forefront in terms of how we age, and being able to establish some boundaries, as well as having those conversations with their family. And the other thing that I see is a little bit of a cultural shift that people in general, I think, will become more aware of just contagion, whether it's seasonal flu or colds or things, and how we all really have a responsibility to, I believe, help protect elders especially, and people who have compromised immune systems. And that's not something that really has been at the forefront of our culture. So, from that perspective, I see that conversation is happening with some of our membership as well.
I think that's wonderful.
Yeah. Um, any last minute thoughts that you would have, something that you think would um, be a benefit to older adults who might still have a lot of concerns just about the information? Where should they go for information? Because there are so many things circulating on Facebook and in the media that may or may not be true. Where should people go for accurate information?
Sure. First of all, I agree with you. I think Facebook is very alarming. There's a lot of anecdotal information that I'm reading on Facebook. I think that truly the primary site would be the cdc.gov/COVID-19, probably the best site to get updated information. Certainly in Indiana, the Indiana State Health Department, they have been aggressive in maintaining and updating their information as well.
Okay, very good. Well, I really appreciate the time that you spent with us to share this information. I know that a lot of folks, especially when they are at home, have more time on their hands to maybe dwell on some of these things. So to hear some accurate information from an expert in the field is really helpful. We certainly appreciate the time that you've given us, Dr. Wenk. Thank you so much.
Thank you very much.